It's going to be a tremendous burden to any doctor's office, Rebecca, and it was very concerning last night to see some of the busiest physicians across the Washington area be genuinely concerned about what's going to happen. And I think everybody watching this evening ought to step back and think about the devastation that's going to happen in the healthcare system if we move forward with this bill. As you've already said, doctors' offices are already flooded. They're already running behind. They barely have enough time to spend with patients in order to do the right thing.
Right.
And if we go through with this bill, it's going to flood the system, and it's going to shorten the amount of time that they're going to actually have with the patient and lengthen the amount of time that you're going to wait.
But Dr. P, are these 30 million Americans not seeing any doctors at all? They're not a part of the medical system at all?
You know, either they're not accessing the medical system because they don't have insurance, or they're going to the emergency room for their routine care. If you play this out, and this came up in yesterday's meeting, that suppose the doctors get filled up, because we have a shortage of doctors, remember, especially primary care doctors.
Nurses too.
The supply can't meet the demand, and everybody's really concerned about that. So if you add these 30 million people now into the system with insurance, you don't have enough doctors, which means the waiting times lengthen.
Right.
And if you can't get in to see your doctor, what's going to happen? They're going to go to the emergency room.
I'm always the positive thinker on this show, the one looking at it at glass half full. We have 15 million people out of work. Maybe they ought to go to medical school, because apparently this is a humongous field to be in. There are jobs out there. It's desperately needed. This demand for doctors, nurses, nurse practitioners, etc. Would you recommend? That's a great idea.
You know, that came up, and we asked the doctors, and a lot of them wouldn't recommend it. There's, in fact, a shortage of medical schools. We don't have enough. It's very tough to get in now, but even those that have gotten in, to some extent, are regretting why, because there are no protections for physicians right now who are overwhelmed that they can't do the right thing for their patients, and who aren't going to be protected down the road because there's nothing in the bill to even talk about tort reform. And that was the other concern. So the doctors are going into the profession to work harder and actually to get less and do less. In the bill that just came out this afternoon, there's going to be an oversight board that is going to look at the cost of procedures and what should and shouldn't be done. So unfortunately, patients aren't going to be able to get what they want, and there is going to be rationing of care. All the doctors agreed that they're going to have to ration care because there isn't enough money to pay for everything all the time. And with this oversight board, somebody's going to determine that you're going to get some tests and you may not get some tests, or you're going to wait for them, which is very unfortunate.
Yeah, and I'd imagine with the health insurance companies negotiating even more discounts, because I see on my statements that the doctor's actual fee and then the negotiated discount, and I'm like, wow, that's all it costs for that? Dr. P, we'll have you on again. Very, very interesting. Love your perspective. Thank you for joining me in the Diamond District.